Hi, everyone. My name is Jenna Hines. I am a second year MSW student at Merrimack College. And I'm here to talk to you today about my capstone project. But before I get into it, I just want to provide a brief trigger warning. Today, we're going to be talking about some pretty intense topics, including childhood sexual abuse and offenders of sexual abuse as well. So if at any point during this video, you need to pause for your own well-being and comfortability, please do so. So, when I first started considering what I wanted to do for a capstone project, I wanted to do something that would make me a better clinician. And I knew that I had a bias coming into this of working with an individual who has sexually offended children. And so I wanted to challenge myself in a way, and I wanted to give myself a real learning opportunity to learn about what really influences this sort of trajectory. And so I chose the topic of looking at that victim to offender cycle, somebody who's experienced childhood sexual abuse, and if that really increases the likelihood of them going on to become a perpetrator of sexual abuse. And so I'm going to be talking to you a little bit briefly about what I found today, and we don't have a ton of time to get into all of the details, but I'm going to do my best with the limited time that we do have. When I started playing around with my search terms and wanting to dive into the literature, I started off pretty broad. As you can see, I had a total in this method section of 17,500 results. And I really wanted to get that number narrowed down to a solid 20 studies and really bring in what all of that literature is really saying. And when I got it down to the 20 studies through kind of some sort of thematic analysis of looking at different abstracts and pulling key themes and seeing what the literature actually said, I was able to narrow it down to just a few topics: cognitive distortions, emotional dysregulation, attachment disruptions, and this idea around masculinity and power. And when I looked at just those core themes, I was able to narrow down my studies and really find the solid evidence that I needed to bring to you today to be able to talk about what really influences this sort of trajectory. Let's begin with my research question and what I was really looking at. How does childhood sexual abuse influence cognitive distortions, emotional dysregulation, disrupted attachment, and these constructions of masculinity and power in male survivors who do go on to offend? And then what factors actually increase or will protect against this overall outcome? And so I want to begin today with cognitive distortions and what I found. So, cognitive distortions, for those of you who don't know, are like these deep-rooted beliefs, right? But they're distorted, they're false, that you might have about yourself, about the world. And some of these examples of cognitive distortions that were found in childhood sexual abuse victims were these ideas of minimization, scapegoating, denial of injury, denial of that harm, right? One participant stated in one of the studies I was looking at, which I found really key to include here, was I am not a child molester, but a victim myself. And that kind of is reflecting this whole idea of how abuse history is used to reframe your identity and avoid taking accountability for the harm that you have caused an individual. Um, Offenders also oftentimes describe their childhood abuse as shaping their understanding of the world. What's normal? What's acceptable? Is this something just because I've experienced it? Is this something that I can go on and do? A lot of people do not get that sort of education addressed in therapeutic settings, resulting in more intense cognitive distortions as time goes on. Emotional dysregulation is another one. Childhood sexual abuse, which you'll see me refer to here as CSA, can lead to emotional reactivity, impulsivity, difficulty regulating your mood or behavior, and increasing risk for acting out in all these harmful ways. It quite literally changes your neurological pathways. It can alter your brain function, your prefrontal cortex, your amygdala, your ability to use judgment and reasoning and control those impulses as well. It disrupts trauma in general, disrupts your HPA axis, which is the body system for, managing stress and emotion. And it makes it really hard to respond to emotions, to understand your own emotions. And cope with them in appropriate ways. So, emotional dysregulation is a major theme that we found in this trajectory. I say we, but I mean me, that I found in this trajectory through the help of other researchers. Attachment disruptions is another one as well. There's four major types of attachment, but the main ones that come out in trauma victims oftentimes are insecure and disorganized attachment styles. And those are really common in childhood sexual abuse survivors because that impacts their ability to trust adults, caregivers. They become avoidant or ambivalent in relationships. And that can be caused by a lot of things. The betrayal that maybe they experienced from a trusted caregiver. Maybe they didn't feel comfortable talking to anybody about the abuse either, which can lead to distorted relational models, leading to detachment, objectification, even seeking comfort from victims at times. Another piece that I really felt was important to touch on is this whole idea of masculinity and power. I focused this entire review on male perpetrators for a reason, and there is a lot of stigma, not only around sexual offenders, of course, but around males who have experienced childhood sexual abuse, as if it damages, this sense of masculinity that we expect males to have, this sort of stoic personality, persevering through any sort of inner turmoil that they're experiencing. And when this abuse involves shame and submission, it can really cause survivors to struggle with feeling weak or masculinity or feeling emasculated. And then they can turn to control and sexual dominance as a way to sort of reclaim this overall power. Another thing that's important to know is males can also oftentimes, during childhood sexual abuse, they can experience physical arousal, which can lead to a whole bunch of other emotions and confusion. And again, those cognitive distortions that can again increase that likelihood of offending behaviors, especially if they're looking to reclaim that sort of power through dominance or sexual activities, behaviors, and aggression. And so, what we really found here, and what I was able to uncover, is that childhood sexual abuse is actually not statistically significant enough to be considered a risk factor leading to offending behavior. So, if you're sexually abused as a child, that does not mean that inevitably you are going to go on to engage in offending behaviors. And there's high risk CSA characteristics, right? So maybe the age of onset, how long the abuse occurred for, whether or not you have co-occurring traumas as well, re-victimization in adulthood. We're looking at substance abuse disorder, and personality disorders as well can influence that trajectory. The need for trauma-informed assessment and prevention is so big in this area. Gender-sensitive care, stable support systems, trauma-informed care can reduce the risk of somebody going on to complete that sort of cycle of abuse, that victim to offender cycle. And so, what you'll notice about all these key themes and why it's so important to the field of social work is that cognitive distortions, emotional dysregulation, attachment disruptions, these are all things that we work on in a clinical setting. You have cognitive distortions. Well, let's do some cognitive behavioral therapy, right? And let's change some of these outcomes and change some of these thoughts that you're having and really dig in and challenge those deep-rooted beliefs. Similar to that of emotional dysregulation, attachment disruptions, right? We can address these things through psychotherapy or psychoeducation, emotional dysregulation, practicing distress tolerance. These are all skills that we can work on in therapy and in clinical settings, which is why it's so important for therapists to be receiving the trainings in order to look for these sorts of things, especially in childhood sexual abuse victims. We can quite literally change this trajectory if we can address these themes, these cognitive distortions, emotional dysregulation, right? And so all of these factors, can they increase the likelihood of offending? Yes. But that outcome's not inevitable. And so early intervention and stable support systems, trauma-informed care, gender-sensitive care can really reduce the risk and promote resilience and recovery in some of these individuals. And I think that that is the main takeaway of this presentation. And so I hope that you enjoyed. If you have any further questions, feel free to please reach out to my Merrimack email, which is all lowercase Hines, Hines, the letter J, @merrimack.edu. Thank you so much for listening. Take care.